I thank JustCap for giving me the privilege to be a part of this awareness program. I am Dr. Nehal Khanna. I am a professor and consultant radiation oncologist at Tata Memorial Hospital. As Dr. Bharat and Dr. Jyoti Bajpayee has already told you all that for all sarcomas, multimodality is the treatment of choice. Surgery, chemotherapy, radiation all play a very important role. I'm a radiation oncologist, so I would like to tell you a little bit about radiation. Radiation, it is also electromagnetic radiation. These are certain rays that are used to kill cancer cells. In soft tissue sarcoma, radiation is given to reduce the recurrence of the tumor coming back after completing the treatment. In certain cases where upfront surgery is not feasible, radiation is also given as a part of neoadjuvant therapy. For Ewing sarcoma, in unresectable cases where surgery cannot be offered, radiation is used as a part of definitive local treatment. In cases where surgery is not possible, the patient should not think that optimum local treatment is not given. Definitive radiation also offers a very good chance of local control. When I talk about radiation, radiation is different types of radiation. The most common radiation that we offer to our patient is external beam radiation, around 25 to 35 sittings of radiation depending upon the clinical situation as well as the type of tumor. We generally give radiation around 5 days in a week. The treatment duration is roughly around half an hour, and the toxicity depends upon the part of the body that we give radiation to. Now we have certain techniques through which radiation can be given with much lesser side effect. This kind of a radiation is called as conformal radiation. Some of you might have heard about different modalities of radiation like IMRT, IGRT. All these modalities are used so that the side effects of radiation can be reduced to a significant extent. By doing this, what we do is the radiation dose that is given to the adjacent normal tissue is reduced, and also ensuring that the desired amount of radiation is received by the tumor. With advancement in techniques, we also offer radiation, a very specialized radiation called as SBRT, to even the sites of metastasis, for example in lung and spine. Another special type of radiation that we do in certain cases is brachytherapy, wherein in the tumor bed we put in certain tubes and we give radiation through these tubes or channels. This is a very conformal way of treating a patient of sarcoma with radiation, and the treatment gets over within 10 days of the surgery. Generally, patients think that a specialized radiotherapy treatment, which is obviously more expensive as compared to conventional radiation, is to be offered to all patients, and sometimes in the OPD they do insist upon a highly specialized treatment. But it is up to the radiation oncologist. We go through the case in detail, and it is seen that in most of the cases of extremity sarcomas, a very special way of treating patients is not required, and even in very simpler institutes, a very simple way of giving radiotherapy can also give that kind of desired outcomes. Once a patient completes his treatment, it is important that we keep calling the patient back for monitoring the side effects of treatment, as well as to keep an eye on the disease, which there is a chance that the disease may come back. So we keep these patients on surveillance. Depending upon the different tumors, the different site, the surveillance protocol differs. We call our patients for follow-up 3 to 6 monthly in the first 2 years, and later on once a year for 5 years, and annually thereafter. If required, along with clinical examination and a careful history taking, we may also do certain investigations like an ultrasound of the site where the tumor was, or even CT scans or MRIs in certain cases. We would insist that patients do come to us for follow-up so that we can pick up diseases at an early stage, and we can also monitor the side effects of treatment. I thank you everyone for giving me the opportunity to be a part of this program. Thank you.